Have you ever experienced a state of wakefulness between the hours of 3 a.m. and 5 a.m., lying awake and contemplating the reasons behind your inability to achieve restful sleep? For older women, this phenomenon should not be dismissed as a mere inconvenience. Rather, it may serve as a significant indicator regarding one's health, emotional state, and potential future health outcomes. And here is the critical point. Many individuals may be unaware that awakening during this specific period can indicate that significant physiological processes are occurring within the body. This video presents 5 effective strategies designed to enhance your understanding of the underlying causes of restlessness and to facilitate the transformation of sleepless nights into periods of tranquility and mental clarity. It is advisable to remain engaged until the conclusion, as the 4th recommendation is frequently overlooked and may serve as a crucial factor in achieving improved sleep quality and overall health. These recommendations are supported by scientific evidence and may enhance sleep quality, increase energy levels, and improve emotional health. If you have been experiencing recurrent disturbances during the night, it is advisable to view this video in its entirety for valuable insights. This presentation will outline straightforward and effective strategies to promote bodily relaxation, enhance mental clarity, and facilitate inspiration during the tranquil early hours of the day. It is important to address the issue of sleepless nights. Together, we can implement strategies to improve your sleep habits effectively. Please take a moment to find a comfortable position as we explore these significant steps that may have a lasting impact on your sleep quality. The solution you seek is readily accessible within a matter of minutes. It is advisable to subscribe and activate the notification bell to ensure that you do not miss any forthcoming videos. Your support is greatly appreciated. If you found this video beneficial, you can assist in disseminating these important lessons by liking and sharing it. If you find the subject matter of this video engaging, kindly leave a comment indicating your interest by typing 1. If you have any feedback, please comment with a 0 to indicate how I can enhance and improve the quality of my videos for your benefit. Let us commence. 1. It is advisable not to impose sleep upon oneself. Rather, consider alternative methods to promote relaxation and facilitate the natural onset of sleep. Envision a scenario where an individual is abruptly awakened during the nocturnal hours. The physical body remains burdened by the residual effects of sleep, yet the cognitive faculties are fully alert and conscious. The clock indicates a time of 3:17 a.m., eliciting a significant physiological response characterized by a surge of anxiety. The heart exhibits a transient arrhythmia. Regrettably, this situation has recurred. The sensation of apprehension manifests gradually, akin to a recurrent, undesired acquaintance. It appears you have previously visited this location, correct? The spiral initiates immediately. The cognitive processes are accelerated. If I were to initiate sleep at this moment, I could potentially achieve several hours of rest. Regrettably, the opportunity for that action has passed. Perhaps only one is necessary. It is concerning to experience difficulty in achieving restful sleep. Various factors may contribute to this condition, and it is advisable to explore potential underlying causes. The heart exhibits a pronounced tachycardia, accompanied by a heightened state of cognitive activity, resembling the chaotic movement of a swarm of bees. The effort to return to a state of sleep appears increasingly futile. Does this presentation resonate with your experiences? The sense of urgency? The frustration experienced in this context is noteworthy. I can empathize with that sensation. You are not alone in this situation. Experiencing nocturnal awakenings, particularly during the hours of 3 a.m. to 5 a.m., is a phenomenon that occurs more frequently than is commonly acknowledged. It is important to recognize that this situation does not signify a catastrophic outcome. However, there is an important consideration to note. When one begins to experience heightened anxiety regarding insufficient sleep, it can exacerbate the situation and lead to further complications in mental well-being. It is akin to exacerbating a condition that should not have been present initially. It is essential to consider the underlying factors contributing to this phenomenon and, more critically, to explore strategies that may alter the trajectory of your evening. Attempting to induce sleep through sheer willpower can be compared to exerting control over an inherently unpredictable phenomenon, much like the challenge of managing a group of independent felines while balancing on a unicycle. The situation is not only exasperating, but it also appears to be ineffective. When you are in a state of rest, with your fists clenched and mentally urging your body to facilitate sleep, you are not effectively calming your mind. You are initiating a significant response. Stress activates a physiological response in the body, leading to an increase in cortisol levels, which is known to contribute to sleep disturbances. Cortisol functions as the body's endogenous alarm system, signaling wakefulness and the necessity to engage with the surrounding environment, regardless of personal preference. It is the persistent internal dialogue that discourages any consideration of returning to a state of sleep. The cerebral activity is heightened, resulting in a lack of restorative rest. Before long, the nervous system may enter a state of heightened activity, resulting in a level of arousal that exceeds the baseline upon awakening. The paradox lies in the fact that the more one resists the onset of sleep, the less probable it becomes to achieve its arrival. Therefore, it may be beneficial to consider ceasing the ongoing struggle. Consider transforming this nocturnal awakening into a more manageable experience. It may be beneficial to consider a brief period of tranquility, or ideally an opportunity for productive engagement. It is imperative that we reassess our current methodology regarding this matter. First, it is important to refrain from remaining in a state of defeat. It is understandable to feel a sense of helplessness in such situations, remaining in a state of alertness while surrounded by darkness. However, it is advisable to refrain from doing so. Assume an upright position with care. It is unnecessary to abruptly awaken and immediately transition into a state of full alertness and activity. A minor adjustment in posture can communicate to the brain that one is not succumbing to feelings of despair. You possess the ability to take control of your situation. You are effectively transitioning to a different mode of operation. Inhale deeply and exhale gradually. Inhale deeply through the nasal passages, count to 4, and retain the breath momentarily. Subsequently, exhale through the oral cavity for a duration of 6 counts. Reiterate and reiterate. This appears to be a straightforward concept, does it not? This practice extends beyond mere relaxation techniques. This serves as a beneficial strategy for optimizing both physical and mental well-being. The gradual, rhythmic pattern of breathing engages the parasympathetic nervous system, effectively initiating a response that promotes relaxation and mitigates stress. Unbeknownst to you, each deep inhalation facilitates a physiological response in your body, leading to a reduction in muscle tension, a lowering of the shoulders, and a deceleration of the heart rate. It is not a phenomenon that can be attributed to magical forces. The principles of biology are functioning to your advantage. Subsequently, consider the underlying reasons for your current state of wakefulness. Foster a sense of inquiry. Is your pillow exhibiting signs of flattening, having undergone extensive use over the years? Is the blanket entangled around your legs, restricting your movement and causing discomfort? The ambient temperature of the room may be excessively elevated, or conversely, it may be insufficiently warm. Has there been an inadvertent opening of a window, resulting in a significant drop in ambient temperature during the month of March? These minor disturbances can infiltrate your sleep patterns and deprive you of essential restorative rest, often without your awareness. However, immediate action can be taken to address the situation. Please take a moment to pause and reflect. It is advisable to rise from your resting position, ensure that the pillow is adequately fluffed, and untangle any sheets that may be constricting. Additionally, it is recommended to adjust the thermostat to a temperature range of 60 to 67 degrees Fahrenheit, which research indicates is optimal for promoting quality sleep. Even a seemingly simple intervention, such as the consumption of a glass of water, can yield significant benefits. Dehydration can manifest unexpectedly, often leading to disturbances in sleep during the night. The primary conclusion: it is important to avoid remaining in a state of inaction, as this can lead to feelings of helplessness and frustration. Exercise agency regardless of the magnitude of the actions taken. Address the discomforts, soothe your mind, and provide your body with the opportunity for adequate rest it requires. These minor adjustments may appear trivial, however, they can significantly impact overall outcomes. The focus is on liberating oneself from the cycle of frustration and restoring a state of mental well-being. Adequate rest is essential for overall health, and the initial step towards achieving this is to cease internal conflicts, establish equilibrium, and allow the body to perform its inherent functions effectively. 2. Ensure proper hydration while being mindful of your choices. Hydration is frequently perceived as a routine activity. This is an action that occurs reflexively, often without conscious deliberation. Upon reflection, it becomes evident that maintaining proper hydration constitutes a significant aspect of self-care. Hydration encompasses more than merely the consumption of water. The focus is on providing essential nourishment to the body, achieving systemic balance, and delivering the comprehensive, nuanced care that is vital for optimal health. It is possible that you have encountered this phenomenon. Awakening during the nocturnal hours, with the time indicating 3:47 a.m., accompanied by a sensation of unease. It is possible to experience nocturnal symptoms such as xerostomia, characterized by a dry sensation in the oral cavity upon waking, akin to the feeling of having chewed cotton throughout the night. Additionally, one may encounter symptoms of restless leg syndrome, where the lower extremities exhibit involuntary movements and an inability to achieve a state of rest, despite efforts to relax. Alternatively, you may find yourself in a supine position experiencing an uncomfortable sensation of warmth, even though the ambient temperature of the room is cool and inviting. It appears that your body may be exhibiting signs of distress, although the specific underlying issue remains unclear. The situation may not appear to be serious, yet it is indeed concerning. Upon careful examination, we have identified the primary factor contributing to the issue at hand. Dehydration is a condition that occurs when the body loses more fluids than it takes in, leading to an imbalance that can affect normal physiological functions. It exhibits subtlety in its presentation. It remains inconspicuous, gradually diminishing the hydration levels within your body during periods of rest. Upon awakening, one may experience a significant physiological response indicative of the body's urgent need for assistance. The sensation of dryness in the oral cavity, accompanied by an unusual restlessness in the lower extremities, as well as the perception of increased warmth, may indicate underlying physiological responses that warrant further investigation. The body exhibits signs of dehydration, indicating a critical need for water, an essential fluid that has been depleted overnight. If you are currently engaged with this video and find the lessons presented beneficial, kindly indicate your continued presence by commenting 1 below. It is common to neglect hydration during periods of discomfort. However, it is important to discuss effective strategies for maintaining proper hydration. During nocturnal hours, the act of hydrating is not merely a straightforward task of consuming a glass of water. This approach is unlikely to facilitate the necessary rest and rejuvenation required for optimal health. Inadequate hydration can exacerbate the condition, potentially leading to increased alertness and discomfort. Proper hydration during nocturnal hours involves more than simply consuming a cold glass of water. Being deliberate in your dietary choices is essential. When executed correctly, your body will respond positively, facilitating a return to a restful and uninterrupted sleep. It is important to recognize common misconceptions that individuals often encounter. The individual extends their hand towards a glass containing ice-cold water. It is understood that during episodes of elevated body temperature, individuals often experience a strong inclination to consume cold and refreshing beverages. Consuming a cold beverage directly from the refrigerator while in a state of drowsiness can have a stimulating effect on the body, effectively promoting alertness. Please consider the implications. Efforts are being made to facilitate the body's transition into a state of relaxation, aiming to restore it to a tranquil and serene condition. Subsequently, the introduction of a cold beverage prompts a physiological response, resulting in a shift in the body's metabolic processes. The exposure to cold water induces a physiological response characterized by a sudden increase in alertness. This stimulus activates the sympathetic nervous system, leading to muscle contraction and heightened cognitive function, counteracting the desire for sleep. It is akin to attempting to provide reassurance to a child who has been abruptly awakened from a dream, only to inadvertently exacerbate their distress by the act of shaking them awake. Exposure to cold temperatures can interfere with the body's natural circadian rhythms, potentially complicating the ability to achieve restful and restorative sleep. What is required is water that aligns more closely with the body's natural physiological state. Water at room temperature, or even water that is slightly warmed, can provide significant benefits. Consuming water at an appropriate temperature can provide a soothing sensation, akin to an internal embrace. The approach is mild and harmonious with your physiology, ensuring that it does not elicit any distressing responses from your system. Consuming water at room temperature minimizes the physiological stress response associated with colder temperatures, thereby promoting a more comfortable hydration experience for the body. Rather, it assimilates the water as though it has been anticipating its arrival. This substance is known for its nourishing, restorative, and calming properties. The most advantageous aspect? There is no necessity to travel to the kitchen for the preparation of an elaborate beverage. It is advisable to maintain a small glass or bottle of water at your nightstand for easy access during the night. Simple and straightforward without any complexities. Provides adequate hydration to support your needs during critical moments. However, it is important to note that water alone may not suffice in all circumstances. If you have been experiencing heightened restlessness or a sense of unease, it is likely that your body has been experiencing a loss beyond mere hydration during sleep. The body has been experiencing a loss of essential minerals, including sodium, potassium, and magnesium. The following electrolytes are essential for maintaining muscle relaxation, stabilizing nerve function, and ensuring optimal energy levels. Electrolytes function as essential conductors within the physiological systems of the body. When physiological systems are in equilibrium, all functions operate seamlessly. Insufficient electrolyte levels can result in symptoms such as dizziness, lightheadedness, or unusual fatigue upon waking, despite having had an adequate duration of sleep. The presence of a mild headache, accompanied by a sensation of being both energized and fatigued, along with an overall feeling of bodily discomfort, may indicate an underlying issue that warrants further evaluation. These indicators suggest that there may be a deficiency in your electrolyte levels. This is where a straightforward yet effective technique can significantly impact outcomes. Consider incorporating a small amount of high-quality sea salt into your hydration regimen, rather than consuming plain water alone. The discussion pertains to Celtic or Himalayan salt, which is distinct from the refined, iodized table salt commonly found in standard salt shakers. The minerals present in these salts exhibit enhanced bioavailability, contributing positively to the maintenance of the body's electrolyte balance. A minimal quantity comprising merely a few granules is sufficient. The focus should not be on excessive sodium intake, but rather on the gradual reintroduction of essential minerals that the body may have depleted during the sleep cycle. This minor modification aids in restoring your physiological balance without placing excessive strain on the renal system or inducing a state of hyperactivity in the body. If sodium intake is not preferable for you, that is acceptable as well. The application of fresh lemon juice may yield beneficial results. Lemon not only imparts a refreshing, tangy flavor to water, but it is also a significant source of potassium, an essential mineral that the body requires for optimal function. Gradually consume your water, incorporating a small amount of salt or lemon juice, and allow it to integrate into your system. Please take your time with the process. Allow your body the necessary time to adequately absorb hydration and to receive the essential nourishment it has been lacking. Engaging in self-care is a vital practice, as it involves attending to your body's needs during critical times. The benefits are indeed substantial. The sensation of xerostomia, accompanied by feelings of restlessness and muscular tightness in the lower extremities, gradually dissipates. Patients may experience a restoration of balance within their bodies, leading to a state of increased calmness and overall ease. The nuanced sensation of renewal, accompanied by a greater sense of grounding and centering, is precisely what one achieves through intentional hydration practices. Engaging in self-care practices can provide significant psychological and physiological benefits, contributing to overall well-being. It is straightforward, yet possesses significant efficacy. Hydration extends beyond the mere act of consuming water. It is essential to provide the body with appropriate hydration at optimal times, utilizing the correct components. It is essential to prioritize self-care, particularly during times of significant personal need. When you engage in these minor interventions, such as consuming room temperature water with a small amount of salt or a dash of lemon juice, you are not merely satisfying your thirst. The process involves re-establishing the body's homeostasis, providing essential elements necessary for optimal functioning and overall well-being. When you awaken during the night experiencing thirst or restlessness, it is advisable to consider your options carefully before consuming any available beverage. Consider taking a moment to reflect on the signals your body may be communicating. Provide it with the appropriate care, and observe the improvement in the quality of your return to sleep. The implementation of minor self-care practices has the potential to significantly enhance not only one's nocturnal experience, but also the overall state of well-being. 3. Assess your emotional state. The time is 4:12 a.m., and you experience an abrupt awakening. The awakening experience is distinct from the usual sensation of grogginess that disrupts sleep, as well as the intrusive sound of an alarm clock. This presentation appears to be distinct from previous experiences. The experience may be characterized by a profound sense of discomfort, as if the physiological processes of the body are undermining the restorative nature of sleep, leading to an involuntary awakening from a state of tranquility. The individual remains in a supine position, enveloped in darkness, yet the silence appears to be increasingly oppressive at this moment. The patient presents with a sensation of pressure in the thoracic region, accompanied by a persistent discomfort and a generalized feeling of unease that is difficult to articulate. The individual may not experience any physical pain or overt discomfort. However, there exists an internal sensation that feels misaligned, akin to a subtle yet persistent tug at the emotional core. It is possible that your cognitive processes are already engaged, reflecting on the events of the previous day. It is possible that you are revisiting a stressful interaction with a friend or partner, or you may be experiencing anticipatory anxiety regarding an upcoming event that elicits feelings of apprehension or fear. Does this resonate with your experiences? The experience of mental unrest during periods of nocturnal stillness is a common phenomenon, often characterized by heightened emotional responses that disrupt the ability to achieve restful sleep. The issue extends beyond typical sleep disturbances. It is a matter that warrants further exploration, potentially involving underlying factors that may not have been previously contemplated. The sensation of restlessness and unease may indicate an emotional awakening, serving as a signal for your cognitive and emotional processes to address unresolved issues. In traditional Chinese medicine, there exists a profound relationship between emotions and the health of particular organs. The lungs are frequently linked to emotional states such as sadness, grief, and stress. Upon awakening during the early morning hours, if one experiences feelings of heaviness, restlessness, or a general sense of unease, it may not be merely coincidental. This may indicate that there are underlying physiological processes occurring within the body, a consideration that may not have received adequate attention during the course of daily activities. This sensation can be likened to a subtle emotional cue, indicating the presence of unresolved issues or burdens that require attention and examination. The tranquility of the night provides an opportunity for the body to manifest these emotions, prompting an invitation for attentive reflection. While it may be possible to disregard certain bodily signals temporarily, the human body will persist in its attempts to convey important messages, often manifesting in subtle yet disruptive ways, such as awakening at 4 a.m. when external stimuli are minimal, compelling the mind to engage with these internal communications. It is possible that this is an issue you have been experiencing for an extended period, potentially spanning days, weeks, or even years. It may be indicative of unresolved sadness or grief, potentially stemming from a loss that has not been fully processed or relinquished. The etiology of stress may be attributed to occupational demands, familial responsibilities, or the cumulative pressures associated with daily living. Concerns that burden you, yet are often relegated to the background due to time constraints preventing adequate attention. It is possible that the unresolved communication, such as an email that was not dispatched, or a disagreement that lacked a comprehensive resolution, may be contributing factors to the current situation. Regardless of the underlying condition, the body possesses an intrinsic awareness of its presence, existing subtly beneath the surface, despite cognitive efforts to suppress it. It is during periods of tranquility, when the cacophony of daily existence is subdued, that these emotions become increasingly prominent and cannot remain concealed. During the early hours of the morning, the body compels an individual to confront certain thoughts or feelings, bringing them into conscious awareness regardless of one's preparedness to address them. In contemporary scientific discourse, this concept is reflected, albeit not necessarily in identical terminology. Research indicates that emotional overload and stress can significantly impair sleep quality. The issue extends beyond the inability to initiate sleep. It involves a physiological state characterized by heightened alertness, persisting even during periods when the body is expected to be in a restful state. Interestingly, the period during which stress levels often reach their zenith occurs in the early morning hours. This phenomenon is attributed to the brain's processing of the emotional experiences accumulated throughout the previous day, regardless of the individual's conscious awareness of this activity. The emotions that have been suppressed throughout the hectic hours of the day become more pronounced, particularly in the presence of quiet and solitude. Have you ever observed that your concerns appear significantly more pronounced during the hours of 3 or 4 a.m. while you are awake in bed? The perception of these thoughts appears to be intensified, rendering them more overwhelming and seemingly insurmountable compared to their previous state. This phenomenon can be understood as the cognitive processing of unresolved issues and the accumulation of emotional burdens that have been carried subconsciously, now manifesting as a significant psychological pressure. In instances where an individual experiences wakefulness during nocturnal hours, accompanied by a sensation of pressure or distress, it is essential to consider the underlying emotional factors contributing to this state. Strategies for managing such feelings may include cognitive reframing, relaxation techniques, or seeking professional support to address the emotional burden effectively. It is imperative that you do not remain passive and allow the condition to progress further. It is advisable to avoid allowing the quiet of nighttime to serve as a catalyst for the development of fears and anxieties. It is advisable to avoid allowing your thoughts to descend into a chaotic state characterized by excessive speculation and self-blame. Instead, take a moment to assess your current state of well-being. Assume an upright position gradually, utilizing a pillow for support and comfort, while ensuring you have adequate space to facilitate proper breathing. If you are currently viewing this video and deem these lessons beneficial, kindly indicate your presence by commenting too below. Initially, this may seem unfamiliar, however, it is important to reflect on the current thoughts occupying your mind. What burdens am I carrying that impede my ability to find rest? These inquiries do not necessitate immediate responses. The immediate identification of a solution is not the primary focus. It involves recognizing that there is an internal process occurring and allowing it to manifest outwardly. The act of recognition holds significant importance as it disrupts the cycle of neglecting the messages conveyed by one's heart and mind. If you feel at ease, please obtain a pen and a sheet of paper to document the information. There is no need for immediate comprehension of the information presented. Allow the expression of thoughts to occur naturally, even if they appear fragmented, disorganized, or unclear. It is of no consequence whether one documents a sentiment as straightforward as "I am experiencing feelings of distress regarding Jen," or "I long for the way circumstances were previously." It may be a more abstract consideration. What are the underlying factors contributing to my feelings of isolation? Please document any thoughts that arise. The objective in this context is not to address the issue at hand, but rather to alleviate it from cognitive burden. Documenting thoughts transforms internal disarray into a concrete representation. It is not necessary for it to be flawless, nor is it essential for it to be orderly. It is essential to allow oneself the opportunity to process emotions adequately. By identifying and naming these feelings, one can prevent them from remaining repressed, which may lead to an escalation in their intensity over time. By acknowledging your emotional state, you initiate a process that can diminish the influence these emotions exert on your well-being. One starts to regain control, not necessarily over the issue at hand, but rather over the manner in which one chooses to respond to it. You have initiated the process of alleviating the factors contributing to your insomnia. At that moment, the healing process has commenced. It is not necessary to possess all the answers or to formulate a flawless plan for resolution. Occasionally, recognizing the significance of your emotional state, allowing it the necessary space for expression, and externalizing these feelings can prove to be more effective than seeking an immediate resolution. This represents an important aspect of self-compassion, emphasizing the necessity of acknowledging and processing one's emotions. It is crucial to engage in healing practices not solely during convenient times, but particularly when confronted with the introspective moments that arise in solitude. Therefore, when that sensation of restlessness arises during the night, it is advisable not to evade it. Embrace the situation fully. Allow it to direct you towards the tranquility and lucidity that you are entitled to receive. 4. Engage in gentle movements to facilitate the resetting of your body's systems. The time is currently 4:23 a.m. once more. The patient shifts position, eyes fully alert, fixating on the clock's unyielding illumination. You attempt to reposition yourself, drawing the blankets nearer. However, they appear to constrict further, forming a complex entanglement that reflects the disarray within your thoughts. The continuous shifting in position yields no alleviation, resulting only in an increasing sense of frustration. What are the underlying reasons that may be preventing you from achieving restful sleep? What mechanisms contribute to the sensation that the body is resisting elements essential for its well-being? This sensation is one that is familiar to you. The passage of time appears to exacerbate your unease, with each tick resonating within your agitated thoughts. The perception of time may feel prolonged, and despite efforts to maintain a state of stillness, the body may exhibit signs of resistance. The patient presents with cervical stiffness, involuntary leg movements, and cognitive disarray characterized by persistent frustration and confusion. What factors may be contributing to my inability to achieve a state of peace? The factual information is as follows. Remaining in a sedentary position on the mattress while experiencing discomfort can exacerbate the situation. Attempts to compel oneself into sleep may inadvertently exacerbate the state of wakefulness, leading to a deeper experience of restlessness. Individuals may find themselves in a recurring pattern experiencing feelings of helplessness and frustration. However, it is important to note that there is a lesser-known aspect. It is not necessary to remain in a state of stagnation. The body exhibits signs of requiring a reset. However, it does not necessitate engaging in a marathon or undertaking a rigorous exercise regimen. What is required is a gentle, soothing intervention to facilitate the release of accumulated tension and promote a return to a state of tranquility. The procedure is straightforward to the extent that it may appear to be an unfair advantage. However, I assure you it is effective. Initially, it is important to dispel the notion that complete immobility is necessary. Attempting to impose stillness upon a body that is physiologically activated resembles the challenge of retaining water in one's grasp. It appears to elude one's grasp. It is advisable to rise from a seated position gradually. There should be no abrupt or excessive movements. Please adjust your position with care. Position yourself against the headboard or extend your legs over the side of the bed if that provides greater comfort. It is essential to allow oneself to engage in movement, recognizing that remaining still may not be the optimal response when the body is saturated with excess energy. Commence by directing your attention to the cervical region. It is likely that the joint is restricted in movement, exhibiting stiffness due to prolonged periods of suboptimal sleeping postures. Gently perform neck rotations. Initially, lower your chin towards your chest, allowing for a mild elongation of the spinal column. Gently incline your head to the right, allowing your ear to approach your shoulder. Inhale deeply while holding your breath, then exhale gradually as you rotate to the left. Perform this exercise multiple times, gradually alleviating the tension in your shoulders with each repetition. Patients may begin to experience a reduction in muscular tightness as the previously tense muscles, which have been in a state of heightened tension, gradually begin to relax and release. This represents the body's mechanism of expressing gratitude for the acknowledgement of its needs. Subsequently, address the shoulder region. Many individuals exhibit a common postural tendency characterized by elevated shoulders, which may result from the cumulative stressors of daily life, including responsibilities and concerns. Inhale deeply and elevate your shoulders towards your ears as if attempting to reach the ceiling. Subsequently, allow them to be released gradually through a gentle exhalation. Perform this sequence 3 to 4 times, coordinating each movement with a deep inhalation. Inhale during the lifting phase and exhale during the release phase. Each instance of release signals to the body that it is permissible to cease excessive tension. The audible cracking or popping sounds you may perceive are generally not a cause for concern. They represent your body's mechanism for alleviating accumulated tension. It is indeed a significant benefit for the entire physiological system. At this time, we will initiate measures to enhance your circulatory function. Please take a moment to position yourself at the edge of the bed for optimal comfort and engagement. Consider performing a gentle seated forward fold. It is advisable to avoid excessive exertion as this is not a yoga practice. Gently flex at the hip joints, allowing your hands to descend towards your knees or the ground, and maintain this position for several seconds. It resembles providing your spine with a gentle, elongating release. Facilitate the relaxation of your muscles and alleviate any tension that may have developed from prolonged periods in a horizontal position. Facilitating increased blood circulation to the lower back can alleviate the discomfort associated with prolonged static positioning. While in that position, please take a deep breath. Inhale through the nasal passages, followed by an exhalation through the oral cavity, while observing the expansion of the rib cage and the relaxation of the body with each breath cycle. The process of deep breathing communicates a signal to the nervous system. The current environment is secure and poses no immediate risk to our safety. This serves as an invitation for the body to release accumulated stress that has developed over the course of the day. Finally, it is advisable to release that excess energy. Elevate one leg sequentially, ensuring the movement remains controlled and gentle, akin to a light oscillation. Envision the process of removing excess moisture from your feet following aquatic activity. While it may seem somewhat unconventional, empirical evidence supports its efficacy. The persistent, restless energy you are experiencing has been sustained for an extended duration. Allow a duration of several seconds for each leg, facilitating the release of tension from the calf and thigh muscles. If you are experiencing involuntary leg movements characterized by restlessness, this technique may assist in alleviating those symptoms. The presence of cold extremities, such as hands or feet, may indicate a need for further evaluation of circulatory function. When the extremities exhibit a sensation of coldness, it may impede the overall ability of the body to achieve a state of relaxation. Begin by briskly rubbing your hands together to generate warmth, similar to the method used to ignite a flame. Subsequently, position your hands in a cupped manner over your feet to provide them with added warmth. This intervention is straightforward and efficient, yet it can significantly enhance the body's ability to achieve a state of relaxation conducive to returning to restful sleep. It is noteworthy to consider that scientific evidence supports this assertion. Studies indicate that an increase in temperature of the hands and feet may facilitate a more rapid onset of sleep in the human body. The decrease in core body temperature prior to sleep is a physiological response, and the warming of the extremities facilitates this process. A warm hand or foot serves as a physiological signal to the brain indicating that the body is prepared for rest. The subtle, gentle movements may appear trivial. However, they serve as a crucial reminder to the body to engage in relaxation, facilitate the release of accumulated stress, and alleviate the tension that may be contributing to sleep disturbances. Consider incorporating a brief 1-minute reset into your routine, as it may provide beneficial effects for your overall well-being. 5. Facilitate relaxation of the cerebral cortex through auditory stimuli. At 3:58 a.m., one may find themselves in a state of wakefulness, experiencing a heightened level of cognitive activity that can be likened to a mental marathon. Cognitive processes are rapidly oscillating within the cranial cavity, akin to the movement of ping-pong balls. Is the door securely locked? Could you please provide details regarding the significant meeting scheduled for tomorrow? What prompted me to make that absurd statement in 2019? One may attempt to instruct oneself to achieve a state of relaxation. However, the more one attempts to quiet the mind, the more pronounced the internal noise becomes. The individual experiences a state of heightened alertness, characterized by a persistent cycle of ruminative thoughts. This condition may lead to a significant desire for tranquility. However, the individual finds themselves in a state of psychological entrapment. The sensation of achieving restful sleep appears to be an elusive experience. Does that resonate with your experience? It is likely that this holds true for many individuals, including myself. If you are currently engaged with this video and find the lessons presented to be beneficial, kindly indicate your continued presence by commenting 3 below. When cognitive processes become excessively accelerated, attempting to induce a state of calm is comparably ineffective to attempting to control a tornado with a paper fan. The situation can indeed be quite exasperating, would you not agree? However, it is important to note that the situation does not necessarily have to remain unchanged. A method exists, a calming intervention, that necessitates no exertion of willpower whatsoever. It is no longer necessary to engage in internal conflict. It is essential to harness the therapeutic potential of sound. The appropriate auditory stimuli can serve as a soothing mechanism, effectively guiding restless cognitive processes towards a state of tranquility and restfulness. It is advisable to refrain from accessing your mobile device. It is important to recognize the allure of continuous scrolling in today's digital environment. However, it can lead to detrimental effects on mental well-being. The release of dopamine associated with prolonged scrolling can exacerbate hyperactivity in the brain, thereby contributing to increased difficulty in achieving restful sleep. Instead, let us concentrate on several auditory techniques that may facilitate relaxation and promote a more expedient transition into sleep, effectively addressing insomnia. The initial item on the list is pink noise. White noise is a sound phenomenon characterized by a consistent auditory signal, often likened to the static produced by a television set tuned to an inactive channel. The auditory experience can be likened to a pervasive blanket of sound. However, it may also present as somewhat abrasive in nature. Pink noise is characterized by its softer, more soothing qualities, making it conducive to sleep. Envision the soothing auditory stimuli of precipitation softly impacting the window surface, the gentle movement of air interacting with foliage, or the consistent oscillation of marine waves. The auditory stimuli presented exhibit a calming effect, do they not? The phenomenon can be likened to a soothing auditory experience provided by the natural environment. The distinction between pink noise and white noise is nuanced yet significant. Pink noise attenuates higher frequency sounds, creating a more comforting and enveloping auditory environment. What is the underlying mechanism that facilitates this process? Research indicates that pink noise aligns harmoniously with the natural rhythm of brainwaves, facilitating a transition into the slower frequencies associated with deep, restorative sleep. A 2017 study conducted by researchers at Northwestern University indicated that exposure to pink noise not only enhances sleep quality but also has the potential to improve memory performance the following day. Envision the experience of awakening revitalized, with cognitive clarity, prepared to engage with the day's challenges. This represents a significant advancement in the field. I consistently maintain a portable speaker or a pre-recorded pink noise track readily available. It is advisable to maintain a low volume, akin to a whisper, allowing the gentle and consistent sounds of rain or ocean waves to facilitate a calming effect on cognitive processes, promoting a state of tranquility. In the event that pink noise does not align with your preferences, or if you seek a more structured approach, a brief sleep meditation may be a suitable alternative. This intervention does not require extensive duration. A concise session of 5 to 10 minutes is sufficient to facilitate your acclimatization. Envision a tranquil voice, reminiscent of a calming presence, guiding you through a structured relaxation exercise. The process will involve concentrating on your respiration, followed by a systematic relaxation of each segment of your body, commencing with the toes and progressing through the ankles, calves, and continuing upward. This narrative serves as a tranquil respite for adults, providing a serene departure from the cacophony of daily life. Furthermore, the most advantageous aspect is as follows. This approach is effective as it engages the brain in a straightforward, seemingly monotonous activity. A stimulus that is consistently soothing and monotonous, effectively alleviating mental fatigue and preventing the onset of anxiety. The auditory stimulus serves as a crucial connection, guiding you away from cognitive distractions and facilitating a return to your resting environment, your sanctuary. There is no requirement to download any specialized applications for this purpose. One may find it noteworthy the abundance of free resources available on platforms such as YouTube and various podcasts. It is advisable to steer clear of content that features abrupt advertisements or excessively loud introductions. It is essential to minimize interruptions during periods of relaxation to promote optimal mental and physical well-being. It is advisable to conduct a preliminary assessment, identify an option that aligns with your preferences, and maintain a low volume level. It is at a volume sufficient to be perceived, yet not at a level that would disrupt your state of rest. The essential approach is to allow the auditory stimuli to lead you, gradually and softly, away from disordered cognitive patterns and towards a state of tranquility conducive to restorative sleep. The impact of auditory stimuli on sleep quality is indeed noteworthy, as even minor variations in sound can significantly influence the overall experience of rest during the night. During instances of nocturnal wakefulness, consider implementing the following techniques for potential improvement in your sleep quality. Clinical observations indicate that these interventions are effective in promoting relaxation and facilitating a transition into restorative sleep, which is essential for overall well-being. It functions as a restorative period for the brain, providing a necessary respite from the demands of daily life. It is important to recognize that you are worthy of this opportunity. As we conclude today's discussion, I would like to take a moment to reflect on the topics we have examined collaboratively. We have discussed the profound relationship that exists between our emotional states and physiological responses. The quiet moments, particularly during the early morning hours, have the potential to unveil aspects of our psyche that we may be consciously or unconsciously avoiding or suppressing. It has been observed that rather than allowing negative emotions to accumulate, individuals can benefit from taking a moment for self-reflection, documenting their thoughts, and alleviating the burden of those intense feelings. This practice is straightforward yet highly effective in enhancing our ability to cope with stress, sadness, and emotional overload. I would appreciate your feedback at this time. What is one key takeaway from this video that you intend to implement in your personal life? Does waking up in the middle of the night constitute a form of self-assessment? Alternatively, it may be the straightforward process of documenting one's emotions to facilitate their processing. Please feel free to share your thoughts in the comments section below. I would appreciate your insights on what resonates with you. If you found this video beneficial, please consider liking, sharing, and subscribing to our channel for additional insights and practical recommendations. Your support is invaluable to us. Please prioritize your well-being, and I look forward to our next video session.